Hi, I'm Derica Upshaw with your FortCavazos Garrison Public Affairs Office. Today, we're talking with two medical professionals from the Army Public Health Nursing Section of Darnall Army Medical Center, talking about the recent medical concerns happening across the nation. All that and more coming up on the Great Big Podcast. Hi, and welcome back to the Great Big Podcast. We're here today with nurses from the Army Public Health Nursing Section at Darnall Army Medical Center. And I'm going to let you introduce yourself and tell us what you do.
Hi, my name is Yesenia Montoya. I am a nurse at Army Public Health at Darnall Army Medical Center. I am the lead for communicable disease for our section where we do disease surveillance and tracking.
Right now we have a outbreak going on. So with the measles, so can you explain exactly what the measles virus is and how it's transmitted?
There is a current outbreak, and so thank you for inviting us, Ms. Derica. So yes, measles is a highly contagious viral infection that affects the respiratory system of patients. And so another name for measles is rubeola. Which some people use interchangeably. And currently it is, we are seeing an outbreak here in Texas, not in our specific counties, but in Texas, close enough to where we need to be aware that it is happening and it can potentially affect our MTF, our soldiers, and our beneficiaries.
So how is the measles virus, how is it transmitted between people?
So it is airborne. So it is transmitted by droplets. So if someone coughs, sneezes, even breathing close enough, it can be transmitted if they touch objects. Like doorknobs, toys, and so someone comes behind that patient or child and goes and touches their mouth, their nose, or their eyes, it can be transmitted that way. Yes. So it's very contagious, mainly amongst those that are unvaccinated.
What are some symptoms that we need to look out for after maybe coming in contact with the measles?
Yes. So typical signs are high fever, over 101. Some patients do spike up to 104. Coughing, runny nose, red eyes. There is what they call Koplik spots, which are white spots in the mouth, specifically on the inside of the cheek. They're small white spots, and so and the big sign is the rash, and it spreads from head to toe, mainly starting at the hairline. Which is very typical of measles, and then it spreads down from the hairline, the face, the cheeks, down to the trunk and the rest of the body.
Now, a lot of those symptoms sound like the cold and the flu. Mm-hmm. When do we know when we need to actually go to the hospital or to the doctor to see what this is?
So it is. I mean, there's 1,001 different conditions that mimic, right, a cold, a flu. But definitely that rash. There's also many different rashes that present in different ways, but specifically with measles, it's from head to toe. Mm-hmm. It's from top to bottom, and those white spots inside of the mouth. Those are telltale signs. Now, combined with maybe of a possible exposure to somebody that was positive, that would be definitely reasons to be seen by a provider, yes. And so you would need to obviously call your provider before you go into any medical facility, because it's so contagious that just being in the same room with other people potentially can be spread to those unvaccinated patients. So it's very important to call your provider first before you go in, yes.
So what is the history behind the measles virus? What preventative methods have been developed to counter it?
Yeah, so the history of measles, it was first discovered in the 9th century. Mm-hmm. So long time ago by a Persian doctor. And in 1963, the MMR vaccine was developed. So as it was in 1963 to today, the best way to combat measles is to be vaccinated. And MMR stands for measles, mumps, and rubella. So it's a combination. And so there's 2 recommended doses. The first dose, the ages of 12 months. And then the second dose you can get after the age of 4. And typically that gives you immunity against measles if you do come in contact with it or exposed. That's the best way to prevent measles. Obviously, the basics, right? Hand hygiene. If you're sick, or of some people that are sick around you, to avoid, sick people. So, but definitely vaccine. I know it's a hot topic sometimes with vaccines, to vaccinate or not vaccinate, but definitely we encourage beneficiaries and everybody out there, do your research, use vetted sources to gather your information, and then make the decision to get vaccinated. Yes.
I know I heard once before that there was a booster shot. Is that true, false?
So there's 2 recommended doses, like I said, at 12 months and at 4 years and above. Now, if you are one of those that comes in contact with a patient that is positive for measles, it is not recommended to get a booster. Now, if you are one of those that are not vaccinated or under-vaccinated, which means you've only received 1 dose, you can get an MMR vaccine, preferably within 72 hours of you being exposed. So again, those are only for patients that are not vaccinated or have only received 1 dose, and that booster or that vaccine can lessen the severity of your illness, and because measles can be have severe symptoms, hospitalizations, and even death, as we've seen. So yes. Also, there is guidance from the CDC that babies less than 12 months can receive an MMR only in an outbreak situation. We're not there yet, at least for our area, but definitely between 6 months and under 12, they can receive an MMR. But that would be obviously with guidance from the primary care. We can't just start giving them, right? They have to see them, evaluate them, their risk, their signs and symptoms, and then decide and recommend, that they can get it. But a booster per se, no. If you're fully vaccinated, you don't need a booster, only if you are unvaccinated or under-immunized.
Okay.
Yes, ma'am.
Awesome. That's great information. So, people's like, well, how can I protect myself even more? But if you already got the vaccine, you don't need to do more besides the basics of keeping up with hygiene needs.
Right, yeah. And if you are exposed and you are fully vaccinated, we, the CDC and we at Army Public Health, we do recommend that you monitor your signs for signs and symptoms up to 21 days. Now, if you are fully vaccinated, there is a small chance that you can develop measles, definitely in a milder way. And, if you are prolonged exposure to someone that's positive. So I don't want to say that it completely rules you out of developing the virus if you are fully vaccinated, but if you do, there's certain scenarios that can lead to the infection, but definitely in a lesser, less symptoms, less severity.
Is there anything you would like to discuss about the measles virus or other issues impacting Army Public Health?
So we at Army Public Health are trying to be proactive instead of reactive. Like I said, we have not had a positive measles in our hospital, in our county, but we want to be prepared. And so we've been working within the hospital to prepare the departments, emergency room, and because typically that's where the patients will go to first if they suspect, to have plans in place as far as education, right? The providers have the education to pass on to the beneficiaries that are coming in, through the doors, that testing is understood and streamlined, and that we're giving the best advice we can for what is happening right now. Hopefully, knock on wood, it doesn't affect our area, but it is happening, and so we want patients to be informed. If you have not been vaccinated, talk to your doctor, pediatrician, and see if you can get those vaccines. That will be your best way to protect yourself and your family. And as more information comes out, we do try and release information to the public and to the hospital via our sources to communicate with our beneficiaries. But stay protected if you have symptoms. Again, we don't want you going straight to the facilities, to the hospitals. Call ahead to the ERs, call ahead to the clinics, so that the clinics and hospitals have a way and can instruct you on how to come into the building. Because just sitting in a room, you can pass it on. So these different sections of the hospital and clinics will have their own way of managing the patients as they come in, putting them into a room all by themselves so that it minimizes the spread. Yes, so just, stay vigilant, monitor your symptoms, especially if you've been exposed, and contact your primary care.
Thank you so much for being here with us today. That was great information that you gave us on how to, stay safe with the measles virus that's out there right now, and how to get vaccinated if we're not vaccinated already. So thank you for joining us today.
Thank you for having me, Ms. Erica.
All right. And we'll be back with another guest to speak more about the measles on the Great Big Podcast.
Hi, my name's Macy Duncan. I am a curator here at the National Mounted Warrior Museum. We had the opportunity to open our doors to the public in September of 2024. The National Mounted Warrior Museum offers educational opportunities, private tours with reservation, as well as over 4,000 square feet of exhibit space that covers 250 years of mounted warrior history. We cover the histories of units and soldiers who have served here on Fort Cavazos and continue to serve today. From the inception of the 3rd Cavalry Regiment and the 1st Cavalry Division, and their continued efforts in World War II, Vietnam, and the global war on terror, we also celebrate the community's role in the development of the post. We hope you come visit us Tuesday through Saturday from 10 a.m. to 5 p.m. We look forward to seeing you at the National Mounted Warrior Museum, where you too can live the legacy of the Mounted Warrior.
Hi, and welcome back to the Great Big Podcast. We have another nursing professional from the Army Public Health Nursing Station at CRDAMC. How about you take a moment and introduce yourself to us?
Thank you so much, Ms. Upshaw, for having us here today. I'm Captain Anea Torres. I'm an Army Public Health Nurse at CRDAMC, and I'm the lead for the hepatitis program on post, but I help out in a multitude of programs at the Army Public Health Nursing Clinic and the Public Health Department.
Okay, awesome. Thank you for being here with us. Earlier, we talked about what the measles were, how they're spread. Can you talk to us now about the current outbreak that we're seeing of the measles?
Yeah, absolutely. So in late January, 29 January to be specific, the Texas Department of State and Health Services issued a health alert for an outbreak of measles in Gaines County, Texas. And the location of Gaines County, that's in West Texas. It's in the southern high plains of West Texas, about 80 miles southwest of Lubbock. And it's bordered by New Mexico to the west. As of Tuesday, March 11th, there have been a total of 233 positive cases in Texas alone, specifically in the western region of Texas. That is quite a large number in comparison to the total number of measles outbreak or measles cases that we had seen in the previous year. In all of 2024, there was reported 285 cases of measles total. So for context, right, we're in the 3rd month of 2025, and there have been reported 223 positive measles cases in the first 3 months of 2025, versus the total 285 in 2024. So just some context for that.
Okay. And how is that comparing throughout all the states, because we know it's not just here in Texas. We're seeing this nationwide. So how is that comparing?
Right. So we're seeing most of the cases in Texas, but there have been reported cases in 11 states so far for this year. But again, most of the cases are going to be in Texas, in the West Texas region. And we have seen, out of those 223 cases so far, as of March 11th, 2025, 29 of those people have been hospitalized, and there has been one unfortunate death from measles in a school-aged child who was unvaccinated and otherwise healthy before they contracted measles.
Speaking on to that, where are we seeing most of the problem come from? Why are we having a big uptake in measles outbreak?
Right, so it's a little bit of a perfect storm. So what the data has told us from the State Department and other public health entities like the CDC, we have seen a couple of different things go on. So first, in Gaines County, it was a county in comparison to all of the counties in the state of Texas. So every single year, the public schools in Texas and accredited private schools in Texas are required to report immunization compliance or immunization statuses of the children going to the schools. That data also shows us if any of the children have exemptions, like medical exemptions or religious exemptions for vaccinations. So Gaines County did have a high exemption rate of vaccinations and a on the lower end of the spectrum of vaccinations. We've seen a slight decline of vaccinations completed in children since 2020 for reasons that we could probably both sit here and talk about for a couple of hours, but we've seen a steady decline in vaccination rates, specifically in Texas, but again, Gaines County had a higher rate of vaccine exemptions. So to put it into better context, right? So the story is, what the data tells us is that high exemption rates, lower vaccination rates, and then we have a virus come into the community that is extremely contagious. Like Mrs. Montoya explained earlier, one case of measles can affect up to 12 to 18 people, just one case. In comparison to other viruses like RSV or COVID-19, one infected person can affect 3, but again, measles can affect 18. So all of those things were in play, the virus comes in, and then it just spreads. So that's kind of the backstory as to how that could have happened as well.
Okay. And are we seeing it floor more so around children or adults?
Yeah, so the current reports for these cases, 223 cases, so they're in mostly children from 0 to 5 years old. There are 76 cases of children who are 0 to 4 years old. There are from 5 to 17, there are 98. For 18 years and older, 38. And there are 11 pending, meaning the investigation's still out on those. So we're mostly seeing it in young children younger than 5. The reason for that, or one of the factors that we can think about, is because those children may not be fully immunized, because being fully immunized is considered having both of those vaccines that you don't complete until about 4 to 6 years old.
Some of those kids were just waiting on that next vaccine to be fully, could have been waiting on that next vaccine to be fully vaccinated, and they just happened to contract it during that time period.
Right.
For those kids who may be just under vaccinated, can they go ahead and receive the next vaccine?
So if they're under vaccinated, as long as they're in the proper time frame, scheduled or recommended age to receive their second dose of the MMR vaccine, then they can. Or if they are in the outbreak area, their pediatrician or primary care provider, will assess that child's risk and need for that vaccine. So that recommendation should come from the provider, and parents can reach out to their providers to get the answer that they need for something like that, yes.
How do those who call the Great Place home counter this outbreak?
Yeah, so we want to keep it that way, right? Where we do not have any positive cases. in our area at Fort Cavazos, and we want to keep it that way. So the best and most effective way to prevent measles from happening in the first place is to get vaccinated. 1 dose of the MMR vaccine will protect a person by 93%, and 2 doses will protect them by 97%. A person is fully immunized after the 2nd dose when they are at that 97% protection. So that's the most effective way. The other couple of ways that we could prevent this from happening is doing just this, is having conversations about measles and getting the information out there from credible sources, from reliable sources, about symptoms, symptom onset. As Ms. Montoya was talking about the symptoms, it's knowing what to look out for in yourself and your children, in your family members, in your parents, in your grandparents, things like that, right? And then once you may see those symptoms, what do you do next? And so again, everything that she said is what we should do. So knowing what the symptoms are and what to look out for. Well, number 1, it's getting vaccinated. Number 2, how does the virus work? How is it transmitted? What are the symptoms that somebody needs to look out for? And what do I do if I think I've been exposed? And that's calling the medical facility or calling your provider to get some guidance as what to do next from there.
Can you tell us, when was the last time we had a measles outbreak?
Good question. So from my understanding, the last measles outbreak was in 2019 in America Samoa, where 94 individuals unfortunately died from measles. And it was kind of the same situation where we saw low vaccination rates and high exemption rates. And again, kind of that those ingredients were a factor in the prevalence of measles during that time. A important fact about measles specifically in the United States is that it was actually the CDC deemed it eliminated, or endemic measles eliminated in the United States. So what that means, endemic means like it normally happens in a community or an area. The CDC said it is eliminated in the year 2000. So elimination was defined as the absence of endemic measles transmission for a period of 12 months or more in the presence of an adequate surveillance system. So that happened actually in the United States in 2000. But we kind of see some people will say, oh, well, measles, we see measles cases every single year. That is true, that we do see some measles cases every single year in the United States. And it's typically due to foreign travelers because there are other parts of the country or other parts of the world where measles is still endemic. The CDC currently reports 57 other countries that currently, have regular measles cases. And people travel and they come back to the United States and things like that. So that is typically how we have seen other cases, or in previous years, cases of measles pop up in the United States. So.
Okay. Yeah, that's a lot. I mean, Americans, we love to travel.
Right.
And coming back, we just got to make sure that we get back into those hygiene habits.
And communicating, with your provider, or if you're a parent, communicating with your provider about what your travel plans are in case you have children and they need to get vaccinated and you're going to a country where, for example, measles is endemic, and maybe they would be eligible for a measles vaccine before a year. So they would recommend perhaps that the child get the vaccine at 6 months. There are some specific stipulations for international travel, and that's something that a parent could talk to their provider about as well.
Okay, that's a great information, especially with PCSing coming up soon, and a lot are being PCS overseas.
Yep.
That's great information to know for our kids, getting them prepared.
So the MMR vaccine is required for service members to have, right? So it is mission critical, and it is essential for force health protection, which is something we work specifically in and try to upkeep in public health, is maintaining that force health protection and maintaining medical readiness. When we put it into the perspective of the family, where measles, mumps, and rubella, or measles is the individuals at highest risk are unvaccinated children younger than 5 years old, or adults who are unvaccinated, pregnant women who don't have any documented immunity. Maybe they didn't get their MMR vaccine before they got pregnant. Those who have a weakened immune system, those people are at the highest risk of suffering from measles. So when we think about that population and we consider, the United States Army, soldiers have families, right? And they may not be able to do their job to the best standard or to the highest standard if they are very concerned about the health of their child or their spouse or what have you, or their partner. So yes, the MMR vaccine is mission critical for the service member, but also for the family members, so that the soldier can go to work and do what they need to do and perform in the way that they need to do for the force. Our most vulnerable population, like for example in measles, those who are at highest risk, like children, they have better things to worry about than measles, right? Like the next Bluey episode or when their grandparents are coming over, they have so much better things to worry about than measles and the potential complications that come with that, to include pneumonia, brain swelling, and in severe cases, even death, So when things like this happen, I know that we're better when we come together and when we can lend a hand to each other. And sometimes that looks like giving them giving people and our community reliable information. So thank you so much for the opportunity for us to do that today. And in the effort to keep our community safe and healthy. And so thank you so much.
Oh, well, it was a pleasure for us to have you guys here. And we hope to see you back soon.
Thank you so much.
All right. And coming up next, more on the Great Big Podcast.
You're in the mix with the man who sets the turntables on fire.
Here comes the I'm literally en route right now, man. Wait, hang on. This song is my jam. All right, so look, tonight we're on Elm Street, right? I'm only about 10 minutes out. And listen, don't worry about Willie, okay? I'm gonna make sure he's there. He's gonna be there. I'm gonna shoot him a text right now, okay? Out.
Sergeant Mathers prides himself in his ability to multitask, on or off duty. Only one problem. Studies show that successful multitasking while at the wheel is not possible. The stats were against him. Reaching for that burger made it 8 times more likely he'd crash. Did you know distracted driving causes nearly 50% of all accidents? All in all, it injures almost 400,000 people a year and kills nearly 4,000. On or off duty, distracted driving is deadly. The bottom line, if you drive while distracted, then you're not driving.
Welcome back, guys. I'm Samantha Harms with the Fort Cavazos Garrison Public Affairs Office.
And I'm Heather Ashley with the Fort Cavazos Garrison Public Affairs Office.
And what a treat for us to be back again together. We did this last week. Happy to have you back on the show with me.
I'm so happy to be back.
Yeah. So I know we talked a lot about measles and the importance of getting vaccinated and kind of, knowing the symptoms and knowing what to look for. I also know that for people who are interested in more information, we've got some stuff for you in the show notes. If you have suspected that you might have the measles, things you need to do, some protocols, all that good stuff. More contact information for you in the show notes, so make sure you check that out.
And always consult with your medical professional.
Absolutely, yeah. I know that I don't know anything about the measles, so please don't call me. I am not a doctor. And I don't play one on television either, so.
I try not to play one anywhere.
Yeah, that's fair. Me either. Even though I've watched a lot of medical shows and I think I could do open heart surgery in an elevator, I probably not, so it would be horrible.
I got on a Grey's Anatomy kick for a long time, and every time somebody complained about something, I was like, oh, there's a Grey's about that.
I know what this is. Well, speaking of a brighter note, it is officially, spring break is over here. Yes. I think there could be some schools that maybe have it this week too, right?
Well, we had it the week before the Colleen schools did.
Oh.
So our schools were out, and now they've been back for a week.
Okay.
Which has been good because girl child is out of my house and
Back in
at
school.
school.
Nice.
But they're getting some nice weather, although the wind.
I know. But the weather's been really nice. Yeah, it's very quickly creeping up on being too hot too fast.
Yes.
But that's okay. I'd rather have it be like, I think even right now, I'd rather have the weather that we're having than have it be too cold.
Same.
Just because Texas has really ruined me.
Skin gets real thin real fast.
It
doesn't
does. Yeah,
Yes.
it really does. Yeah. So because I'm from Kansas and like, you know, I'm very proud to be a Midwestern girl. And every time I go home now, every time I leave the state of Texas, I'm like, okay, it's 80 degrees in Texas, but it's gonna be like 60 degrees somewhere else, or it's gonna be 80 degrees somewhere else. I'm like, but what does it feel like there? Because here, I know what to expect now, but I am ruined for any other weather anywhere else in the world now.
Yes, I went to Kansas City in October, and the temperatures were mild.
Yeah.
But I was frozen, of course.
Oh, of course. Yeah.
Because of the wind, and it's just 50s colder there.
Yes, it is. It absolutely is. Yeah. Well, speaking of Kansas, I think we need to have Monty come back on. Give us a little recap. Maybe we do a Sports with Sam segment where you tell me about sports. That's what I used to do back in the day. So let us know in the comments if you want that. Have Monty come back in and talk about March Madness.
Or for us, March Sadness.
March Sadness, yeah. Yeah, starting out ranked number 7, KU.
It's not a good job.
It's not a good
year.
No, it's not. Broke our 25 years. 25 years of being in a number 1 seed, or at least in the top 4.
At least in the top 4.
Yeah. Horrifying.
I was really nervous about even making the tournament.
Oh, honestly?
Weeks ago.
Yeah, me too. Yeah. Yeah.
Still proud to be a Jayhawk, though.
Rock Chalk.
Always.
Rock Chalk till the day I die.
Yes.
That's the way it should be.
Start strong and strong.
I love that. Well, let's talk about starting the week off strong outside of basketball. What do you got going on for the week?
Oh, I'm going to OPSEC 2.
Ooh,
level 2 training.
yes, you
so
are.
I'm excited for that.
Yes. You know what? So we've had a podcast episode. It's pretty old now. When I say old, I just mean in terms of like we recorded this a few years ago. But for people who are interested in listening, it is audio only. For people who are listening audio only, you can watch us on YouTube. So say hi. Hi, everyone. Yes, so you can watch on YouTube now, see our lovely faces. But for people who are interested, we had an episode that came out a few years ago. It's called I Know Where Your Cat Lives. It is about OPSEC, like operational security and making sure that you are taking care of your data and your privacy, especially when you're posting things on the internet. So we talked a lot about in that episode, somebody had posted, there's a website called I Know Where Your Cat Lives, and people would find photos of cats on the internet and could pinpoint exactly where the home of that cat is based off of the data in the photo. Incredible. Terrifying. But yes, what a time for you to do this.
There's a guy on social media who people send him photos and they say, guess where I am? And he walks through the steps of
how he does
He finds exactly where these people are.
Wow.
Based off these obscure clues and Google Earth and all kinds of, it's insane to watch. But OPSEC has scared me since I've done several stories on it where they talk about the passwords. Like, you know, you don't want to use anything familiar to you.
Sure.
And then, but then your questions to retrieve your information when you forget they say you always have to lie.
Oh, interesting.
Well,
how am I going to remember a lie?
Right. So then they said, well, write them down somewhere. Well, I would lose that.
Yeah, absolutely.
Or put it in your phone.
Right.
And you're locked.
Oh, I do that.
I do that too.
Yeah.
So if I ever lose my phone.
Oh, it is game over for me.
Exactly.
Yeah. Well, I'm excited to see what you learn. Come back a wealth of knowledge for the office.
Oh, yeah.
And what's our word for the week?
Boring.
Boring. Oh, no.
Let's be boring.
Okay.
No excitement.
Okay. Sure.
Just
I'll sign up for that.
Yeah.
I'll sign
on
up
board that.
for
Just
boring.
1 week of boring.
Okay.
You know,
I'm
when
down.
you were a kid and
Yeah.
everything was so boring.
Oh, yes.
I
You
miss
just want
that.
everything to be really fun all the time. And then now you're in the fun and you're like, wait a second, what did I sign up for?
Right. Now I
Yeah.
want boring.
Yeah.
I want to be so bored. Oh, that's what I want.
I love it. Okay. I'm down to clown. Boring it is.
So you got to share with us what you're doing this week.
Honestly, I have not a clue.
Hey, that's good.
Yeah. I don't know. I don't know what I'm doing
You
this
can
week.
control it and keep it boring then.
I think so. Yeah. I think that's the ideal situation to be in.
Yes.
Yeah. I know I have a lot of meetings, but that's pretty usual for me. So that's
Not
about it. That's
exciting,
all I can
so-
think about. That's not exciting. Yeah. I don't know. I guess we'll see what the week has to offer.
Sounds good. That's a good. That's good. That's a good plan.
I think it might be too exciting though to have that be the plan.
the anticipation.
Yeah. You just don't know what's going to happen.
Yeah.
That seems exciting.
Yes, it does.
Ugh.
You need to plan your week out.
I do. Yeah. I think as soon as we're done with this, I got to go do that.
Pencil in every moment.
Exactly. Yeah. Yeah. I think that's a great idea. Well, I better get going. So it's been a real fun treat
Yes, it
chatting
has.
with you.
I love this.
Yes, me too. Okay. Well, I think that's all we've got for this week. So we will talk to you guys next week.